The role of virtual beings in modern therapeutic practices. The intersection of technology and mental health has given rise to innovative approaches in therapeutic practices. Among these, the use of virtual beings has emerged as a promising frontier, offering new possibilities for treatment and support. Virtual beings, ranging from digital avatars to AI-powered conversational agents, are increasingly being integrated into various forms of therapy, addressing a wide spectrum of mental health conditions. This paper explores the growing importance of virtual beings in therapy, examining their applications, underlying technologies, benefits, challenges, and future directions. Virtual beings in therapy take various forms, each suited to specific therapeutic needs. Digital avatars, for instance, play a crucial role in treatments like avatar therapy for auditory hallucinations. In this approach, patients create digital representations of the voices they hear, which therapists can then control in real time to help treat conditions like schizophrenia. Virtual reality, VR, simulations represent another category, exemplified by systems like BraveMind. Developed by the USC Institute for Creative Technologies, BraveMind creates immersive environments for exposure therapy, particularly for veterans suffering from PTSD. These simulations allow for gradual, controlled exposure to trauma-related scenarios in a safe, virtual setting. AI-powered conversational agents are becoming increasingly sophisticated, offering 24/7 support for various mental health concerns. These virtual therapists use natural language processing to engage in therapeutic dialogues, providing support and interventions based on established therapeutic approaches. Metahuman representations, highly realistic digital humans, are also finding applications in therapy. For instance, they are being used to visualize speech patterns in speech therapy, offering a new tool for therapists and patients alike. The applications of virtual beings in mental health treatment are diverse and continually expanding. Avatar therapy, mentioned earlier, represents a novel approach to treating auditory hallucinations. By giving a face and form to the voices patients hear, this therapy aims to help individuals gain control over their hallucinations. Virtual reality exposure therapy, as implemented in systems like BraveMind, has shown promise in treating PTSD. By recreating traumatic environments in a controlled, virtual setting, therapists can guide patients through exposure exercises, helping them process and overcome their trauma. Cognitive behavioral therapy, CBT, is another area where virtual beings are making an impact. Virtual coaches and AI therapists are being integrated into VR environments and smartphone apps, offering guided CBT interventions for conditions like anxiety and depression. The Zaya system, for example, combines VR, spatial computing, and AI to provide personalized therapy sessions in immersive, biophilic VR settings. Substance abuse treatment has also seen innovative applications of virtual beings. Researchers are exploring the use of future self-avatars in VR therapy, allowing individuals to visualize and interact with representations of their future selves as a motivational tool for recovery. In the realm of speech therapy, virtual beings are being used to create interactive visualizers. Researchers at the University of Technology Sydney, supported by an EPIC mega grant, have developed a system using Unreal Engine and metahumans to create responsive avatars for speech therapy applications. Grief counseling is another area where virtual beings are being explored. Chatbots designed to help people cope with the loss of loved ones are being developed and studied, offering a new avenue for support in the grieving process. The implementation of virtual beings in therapy relies on a confluence of advanced technologies. Virtual reality, VR, and extended reality, XR, platforms form the backbone of many immersive therapeutic applications. These technologies allow for the creation of controlled, interactive environments that can be tailored to specific therapeutic needs. Artificial intelligence, and natural language processing power the conversational abilities of virtual therapists and chatbots. These technologies enable virtual beings to engage in meaningful dialogues, interpret user inputs, and provide appropriate responses based on therapeutic principles. Brain-computer interfaces, BCIs, and emotion mapping technologies are pushing the boundaries of how virtual beings can interact with users. For instance, researchers are developing systems that can map human emotions based on EEG signals onto 3D avatars, potentially offering new insights into emotional states during therapy. 3D modeling and animation techniques, exemplified by technologies like Epic's Meta-Human Creator, allow for the creation of highly realistic digital humans. These metahumans can provide more engaging and relatable interfaces for therapeutic interactions. The integration of virtual beings into therapy offers several potential benefits. Perhaps most significantly, it increases accessibility to mental health support. Virtual therapists and AI-powered apps can provide 24/7 availability, offering support at times when human therapists may not be available. Personalization and adaptability of treatment are other key advantages. AI systems can analyze user interactions and adapt their approaches in real time, potentially offering more tailored therapeutic experiences. Virtual environments provide safe spaces for exposure and practice. In VR therapy for conditions like agoraphobia, patients can practice everyday tasks in virtual settings, gradually building confidence to face real-world situations. The potential for cost-effectiveness and scalability is another significant benefit. Once developed, virtual therapeutic tools can be deployed widely at relatively low marginal costs, potentially extending mental health support to underserved populations. Despite their potential, the use of virtual beings in therapy also presents challenges and ethical considerations. Privacy and data security are paramount concerns, given the sensitive nature of therapeutic interactions. Ensuring the confidentiality and proper handling of user data is crucial. There's also a risk of over-reliance on virtual support. While virtual beings can offer valuable assistance, they should not be seen as complete replacements for human therapists, especially in complex or severe cases. Ensuring the efficacy and quality of virtual therapies is another challenge. Rigorous research and clinical trials are needed to validate these new approaches and understand their long-term impacts. Regulatory and licensing issues also need to be addressed. As virtual beings take on more therapeutic roles, questions arise about how these systems should be regulated and what standards they should meet. The uncanny valley effect and user acceptance remain challenges, particularly for highly realistic virtual humans. Striking the right balance between realism and comfort is crucial for effective therapeutic interactions. The future of virtual beings in therapy holds exciting possibilities. Integration with other emerging technologies, such as haptics and brain stimulation, could further enhance the immersiveness and effectiveness of virtual therapeutic experiences. Advancements in AI are likely to lead to more human-like interactions, potentially increasing the depth and nuance of virtual therapeutic relationships. The expansion into new areas of mental health and wellness seems inevitable as these technologies mature. There's also potential for hybrid models combining virtual and human therapists. Such approaches could leverage the strengths of both, offering personalized, accessible care while maintaining the irreplaceable human element in therapy. Virtual beings represent a transformative force in mental health treatment, offering new tools and approaches to address a wide range of conditions. From avatar therapy for auditory hallucinations to VR exposure therapy for PTSD, these technologies are expanding the possibilities of what therapy can achieve. However, as we continue to develop and implement these technologies, it's crucial to proceed with caution and responsibility. Rigorous research, ethical considerations, and a focus on patient outcomes must guide the evolution of virtual beings in therapy. The potential of virtual beings to increase access to mental health support, personalize treatment, and provide safe spaces for therapeutic work is significant. As we look to the future, continued research and responsible development will be key to realizing this potential and improving mental health outcomes for individuals worldwide.